up next, let's talk about RCC. So tell us what came out of ASCO with RCC that was exciting.
Absolutely. So we heard about a 5-year follow-up for Keynote 564, and a reminder that this is the trial for which adjuvant pembrolizumab is approved after nephrectomy for localized RCC. And the results showed that the estimate overall survival rate at 5 years was 87.7% with pembrolizumab versus 82.3% for patients on placebo. And then we also heard about a final analysis of Checkmate 214. So a reminder, this is the original trial for which we have ipi/nivo in frontline metastatic RCC. And of patients who responded, it's really amazing that a half are still responding 9 years later. And so when we think about choosing this regimen of ipi/nivo versus IO-TKI for someone with a new diagnosis of metastatic RCC, we hope for this type of durable response. And that's one of the caveats that we tell patients when we counsel on one versus the other. And then we also heard about the step 1 analysis from Pedigree. And so this is an adaptive trial that also has ipi/nivo upfront. And then based on the response, if patients have stable disease or a partial response, they get randomized to either the standard nivolumab maintenance versus adding cabozantinib or TKI. And so in the results presented in step 1, a third of patients stopped the treatment before enrolling to step 2, which is when they were stratified, of which 44% were due to side effects and 13% stopped due to progressive disease. And 29% of patients had grade 3-4 immune-related adverse events, most commonly diarrhea, colitis, followed by rash, LFT elevation, adrenal insufficiency, fatigue, and hypophysitis. So I think it's still really important when we're giving ipi/nivo to really counsel patients on alerting us if they have any of these symptoms.
Definitely. And so I think the reason we all talk about ipi/nivo across all solid tumors is to try to go for that tail of the curve, that durable response. I mean, that really is the game changer as we saw in melanoma, and it's just kind of trickled down. So if it responds, people do really well. We just hope to have as many people respond up front as we can, or how to improve on that, or predict who will be a responder.